Hi, my name is Charlotte Tenney, and I'm here today to express my appreciation to Dr. Ben Johnson for guiding me through to complete remission from stage 4 lymphoma cancer type B. So, thank you. I am so glad I met you and that I actually survived this thing.
It was a pleasure working with you. You were just kind of like the ideal patient because you were very interested in your health and your living, so much so that you're willing to look outside of the box a little bit, and you're willing to do what I asked you to do, and yet very interested in nutrition and herbs and keeping your mental hygiene up. So you were perfect. So congratulations to you, Charlotte.
Well, and thank you. I couldn't think of anything more important to do than to do what you told me to do so I could stay alive. It was a couple of months after my diagnosis that I found you, and I don't think you were very impressed with my state of being at the time. I had lost about 40 pounds, and I was very fatigued and not doing well at all. I looked like a skeleton. I was scaring most people around me.
You were a little ragged around the edges at the moment. So how did all this start?
Well, in September of 2012, I started feeling badly, and I wound up in the emergency room, unable to breathe, and with a resting heart rate of 120 and running a fever, and not sure what the heck had happened to me since the week before I had been out gardening full force, and they performed thoracentesis and pulled a liter of fluid from around each of my lungs.
So 2 liters of fluid.
2 liters of fluid.
Wow, that's a lot. Half a gallon of fluid.
And the reason I couldn't breathe was because my lungs were collapsed.
Yeah.
So that was pretty startling to me, and they told me that the reason this was going on was that I had stage 4 cancer. And the oncologist I talked to said, well, basically, we'd like to start treatment right away, and that can offer you a few months for you to get your affairs in order, but you're not going to make it. I was shocked. Thought any doctor who is convinced I'm going to die isn't really the one I want to have in charge of my treatment.
That's not a good combination. You're going to die, let me treat you.
Well, I began interviewing doctors, and I went from medical organization to medical organization talking to oncologists, and my education was that they were only offering what they had to offer. They are, by standards of practice, supposed to offer 1 or up to 4 of a particular drugs recommended for lymphoma, and that's all they have to offer. They knew nothing about nutrition, they knew nothing about supplements, and they knew nothing about working together with the immune system to help cure the condition.
We took a different approach. We harvested your cancer cells and sent them off to Europe and had them tested for what kind of herbs, nutritionals, homeopathics, and yes, even chemo agents, which we could use in a very different way than what standard oncology uses, but still they can be useful. And so then we had a roadmap of exactly what would work for your specific cancer cells.
And that was quite surprising when I did go back. I had to maintain a contact with the medical community because I needed continuing thoracentesis. In fact, that turned out to be how we were gauging our results. When we started treatment in November of 2012, I began to feel better almost immediately, but by then I'd been going in for regular thoracentesis with the same nurse practitioner every week, and she began to see the amount of fluid reducing and my level of energy coming back and me gaining weight. She had also expected me to die, and she was very curious about what we were doing.
Yeah, they are interested to some degree, but they don't want to know too much, or else then they become responsible. But so you progressed, you got more energy, and we treated you for a little over a year.
But the results were pretty quick. As soon as June of 2013, I went on a road trip and went hiking in the high Sierras. I didn't think I'd be able to do it, but I got through it just fine. And that's when I really knew Well, the month after that, I quit having
Knew that you were
thoracentesis.
back.
We continued treatment for another 6 months, and then remission was December of 2013.
Yeah, you were probably in remission in September, but thank you for doing it my way, because I wanted some extra time, because I just wanted to make sure that we had all of those hanger-on cells out there that were hiding, that we'd taken care of them.
Well, my immune system thanks you, because it needed every last bit of nutrition support we gave it to regain its strength and stand on its own. And so, yeah, thanks for browbeating me into hanging in there until December.
And what message would you share with people watching? If you could say one thing in a paragraph, what would you tell them?
Well, what I have to say to people who have a dire diagnosis in cancer is, don't take no for an answer. There are other options out there. You can find people that will work with you, and they will not destroy your immune system. They will find a way to strengthen your immune system and help you heal for real. So, take responsibility for your health. Make decisions that make sense for your body.
Thank you, Charlotte.
Thank you, Dr. Ben.
Absolutely.